Innovation and advancement of medical imaging has resulted in a seismic shift in patient care. It has significantly changed how clinicians measure, manage, diagnose, treat and even think about illness and disease.
So here's an aneurysm of the aorta. I've been able to take measurements for a graft that would repair this aneurysm.
Radiology sits right in the middle of healthcare. It's the piece which really renders diagnosis fast and accurate, and as a consequence, it is central to delivering healthcare outcomes, optimised healthcare outcomes, and also keeping costs down.
But these gains are being hampered by a major roadblock.
Well, basically it's a lack of interconnectedness more than anything else. Radiologists, hospitals, all sorts of providers are very good at acquiring and storing excellent data, but they don't have the systems which allow data to be shared between providers and clinicians in a seamless and timely way.
That's causing unnecessary heartache for those most in need of help. 16-year-old Joel was born with microcephalus, and his ongoing issues include cerebral palsy and epilepsy. With half a dozen hospital admissions a year, his medical history is extensive. But during his most recent crisis, the hospital was unable to find a vital set of earlier brain scans. Thankfully, Joel has made a good recovery, but it's not the first time important records have gone missing. The family's had 4 interstate moves and feels the burden of keeping track of vital information.
Documentation, scans, pictures, everything that will help us to be able to give medical staff the best information to get the best care for Joel.
When breast screening reveals a cause for further investigation, patients and their imaging are sent on to referring doctors. But if they arrive without copies of their scans or with images from incompatible systems, they may face more X-rays and hence more radiation, or even delayed surgery. It's also vital for referring doctors to know the more detailed imaging they conduct can easily be accessed by surgeons wherever they are.
Essentially, we are often pinpointing where a cancer is in a breast for a surgeon, and we need to be able to impart exactly that information to the surgeon. So if our imaging doesn't reach the surgeon, there's a potential that a cancer might not be accurately removed.
Continuity of imaging also plays an essential role in joint replacement, where a surgeon might need to monitor a patient across many years, using scans taken elsewhere.
We keep the X-rays and we monitor them carefully, and by doing that we're able to see changes in the implants and pick things up earlier, pick problems up earlier before they would otherwise be noticed. And if you don't have the scans, you don't have the same insight into how that particular joint's working, and you might miss things.
As well as cross-practice difficulties, there are also cross-border hurdles. Gold Coast Hospital frequently treats emergency cases flown in from northern New South Wales, who've had scans at regional hospitals that can't be accessed remotely.
Mostly they come with a disc, or worse than that, with a piece of old-fashioned film, and it would be much better for us if the images could come directly through our electronic systems. The problem, of course, is that all the private practices, all the public hospitals, all have different computer systems which don't talk readily to each other.
With earlier access to scans, doctors could be planning surgery, ordering necessary parts for grafts, and be ready to go by the time the patient arrives. According to patient advocates, interconnected data systems are long overdue and would empower patients to better take control of their own healthcare.
Well, the interesting thing about all your medical records are that they are yours. And so if you have them, that is your receipt to engagement with the medical fraternity. So you, especially if you have cancer and you're diagnosed with cancer, treatment in a multidisciplinary environment is very, very important, and you need those records to go with you as part of this cancer journey.
As Australian governments grapple with the vital but challenging task of integrating a national e-health system, the medical imaging community has already made major steps in identifying workable solutions.
I think the way forward is to use what we already have and then to overlay IT systems and processes which allow that important interconnectedness of data and data transfer to happen easily and quickly.
So what we're looking for is a technical solution to federate those computer systems together. And there are a couple of technologies now which are becoming established around the world for making that happen.
It's a road Joel's family hopes we'll travel soon.
Well, if we weren't around, we would want to know that Joel is able to get the best care because the person who is caring for him or medical staff will be able to access all his information at one central point.
So the distance we have to travel to get where we need to be is relatively small and the impact is substantial.